Hi there. Thanks for having me today. What I'm going to do is I'm going to offer an overseas nurse's perspective relating to reporting and learnings that can be had from adverse events in the operating theatre. So I just thought I'd start a little bit just about me to get us started. So my name's Cassie Scott. I'm a perioperative registered nurse and I have been since 2005. I've worked in a few countries during my perioperative nursing career. Currently, I am living and working in New Zealand as a perioperative charge nurse manager. Underneath there, you can see all of the professional organisations, the perioperative organisations that I'm a proud member of. And there's also a LinkedIn code down the bottom there that I welcome you to scan and connect with me. I'm more than happy to answer any questions about our practices here. So, yeah, reach out. Okay, so I'm going to talk about incident notification systems and what we do here. This is an overview of how we manage incidents here in my facility and what we do to notify. It's important to know that this is part of our wider hospital policy, which staff have to adhere to. So, how do we notify? So all adverse events, whether or not it's an actual event or a near miss, must be reported immediately to the line manager. So that could be a charge nurse manager, or if it's out of hours, as we are a 24-hour 7-day a week service, and there's always not a charge nurse manager there. It could be a person in charge, like a clinical nurse coordinator. So in addition to reporting it to that manager immediately, we also require staff to enter the information on a digital reporting system, and that should be as soon as practical, preferably before the end of the working day, but we acknowledge that that's not always possible. The manager is then notified by email that a report's been submitted, and then it's up to that line manager to investigate the report. The manager then determines whether or not anything needs to be done immediately to mitigate any risks, and that's to the patients or to the staff members. And on the next slide, we'll go over what we call a SAC score, but that's a rating tool that we use to determine the severity of the incident. If it is a SAC score 1 or 2, we're bound to refer that to the Health Quality and Safety Commission here in New Zealand. Depending on the incident as well, the line manager may feel that it's important to get input from other committees such as the Health and Safety Committee or Infection Control. So that really just depends on the event and what's happened. So this is what we call the Severity Assessment Code, which is a SAC score, and it's a triage tool. So basically it goes from 1 to 4, 1 being the most severe, so death or permanent loss of function, all the way down to SAC 4, which is a minimal injury and mostly includes our near misses. So you may possibly have something similar to this in your countries, but it is important to note that these SAC scores, say for example the SAC score for these near misses, they're just as important to document as the actual incidences, because you need to have that information recorded so you can initiate changes and you can implement them within the departments without having the information recorded. We don't have any evidence and you can't identify any trends. The other thing that has been released through the HQSC is the always report events. And so of this list, 2, 3, and 4 are most relevant to the operating theatre. So that's wrong site surgery, wrong prosthesis implanted, and a retained foreign object post-procedure. These incidences, which fall under this always report categories, are automatically referred to the Health Quality and Safety Commission, and it gets a full and external report. I've included the QR code here if you want to give it a scan. It is in English though, but maybe you might be able to get it translated or someone could do for you. I don't know. Technology is great these days. Google can do a lot. you may be able to have a read of that, and it gives you a little bit more information about what is considered these always reports. Okay, so this is really important part of the topic because culture has direct impact on whether or not an incident's recorded or not. Here in our department, we have a very positive culture and we've worked very hard to achieve that. So it is now the norm and the expectation to report any adverse events. By doing so, we ensure that our patient and our staff safety is the centre of everything and it is paramount. Each incident we view as an opportunity to learn and to improve our clinical practice. So we do this by communicating to the entire team. We involve them in the journey by including a snapshot of recent reports at our staff monthly meeting. We discuss the events, what's happened. Those who have been involved in an adverse event have the opportunity to host an education session to inform others what happened in that event and any applicable policies and procedures. Now, this is all done very professionally in a positive light. It's a no blame situation because you have to spread the word and you need to do it in a positive and an open manner. We have a staff newsletter that's distributed to our department every week, and in that we have a recent incident column, and that explains what's happened over the last week, and if there's any trends that are starting to be identified. The other thing we really do well here, in my opinion, is we have a really comprehensive orientation for our staff members. Now, this isn't just novice nurses. This is also people who have come with other experiences because each hospital has a different way of doing things, and it's the best way to get people on board and to reiterate the expectation that we have for reporting. So what we do is we host our education team runs simulation sessions. So that will be, say, for example, an incorrect count, what the expectation is, what the policy states you should do, how you're supposed to do it, equips people with the skills to learn how to speak up and advocate for themselves, but also for the patients. We have lectures on the count policy, and we also do training on the digital system and how to use that digital system. Trying to reduce the barriers that can be there for people if people don't know how to use the digital system, they don't feel comfortable with it. Giving them training in a nice, relaxed, stress-free atmosphere will help to get people to do those reporting. And the outcome, people in our team support their colleagues through these difficulties. They learn through other people's experiences. But most of all, we have a dedicated team who are strong patient advocates. Now, there's some graphs down the bottom there, and what you can see is these are sort of a sample of what we would show our staff. And as I said, identifying trends is a real key for us because not everybody's a learner that learns through speech. People like to see things written down, so that's really clear to show that you've got a decreasing trend in a particular topic or an event. So I've already sort of touched on the first two things here. So this is from an organisation level response. What happens from the organisation, not just a departmental approach. So as I said, in the adverse event reports are investigated, and sometimes there's a root cause analysis. It's referred on as appropriate to external bodies. Most importantly, though, we communicate, and this is always done in a positive manner. So the organisation distributes reports. It's included in departmental meetings. There are committees that are involved, and we communicate through staff members, staff newsletters, and the hospital intranet notices. Why is it important to report? Well, as I said, it identifies trends. it improves patients' safety, but also staff safety. You can only make changes to the current practices if you've got the evidence and you've got the information. So reporting whether or not it's an actual event or a near miss is the only way you can make changes. You've got the evidence to support these changes to the current practices, but also sharing with the team. You discuss all of these safety incidents, then the staff are equipped with the knowledge and the information to make those changes, to bring them on the journey. Now, in New Zealand, and it may be different to other countries, but we are bound through the Health and Disability Services Consumer Rights Act. And in that states that the patients have the right to be fully informed. So we are bound by an open disclosure process. So if there are any adverse events that happen, we are bound to disclose this to our patient. And that includes what happened in the event, how it happened, why it happened, and if applicable, or what has been done to prevent, what steps have been done to prevent this from happening again. And that's a really good process for the patient. The patient gets answers, but it also helps the patient, the staff members along with this journey. I just wanted to finish on this quote because I thought it was quite fitting for this. I've worked in facilities before where you get the response to a question that you might have. It's the way it's always been done. That's the way we've always done things here. So this is great advocacy to change what is into what should be. So communicate with the staff members, bring them along on the journey, equip them with the knowledge. Learning from other people's experiences gives you the opportunity to change what it is currently into what should be, because at the end of the day, we're all here for our patients. We're patient advocates and we're protecting the patients when they're most vulnerable. We also have to protect our staff as well. And so making changes to what should be from what is key here. So thank you, everybody. Hopefully, you've gained a little bit of insight as to what we do here in my facility. As I said, I'm happy to answer any questions. This was just a very quick, brief overview, but if you've got any questions, reach out to me. I'd love to answer them for you. Thank you.